Hello, my name is MIheso, and I'm the Chief of Party for Breakthrough Action, a project of the Johns Hopkins University Center for Communication Programs that seeks to promote healthy household behaviors and strengthen health systems to improve the health of the Kenyan population. Today, I want to talk to you about an issue that is so close to my heart: the lack of women in leadership positions and global health. We all know that in families and communities, women undertake the majority of unpaid caregiving and domestic work, while also making the majority of decisions on buying and seeking and practicing healthcare. With women making up over 70% of all health worker jobs globally, it is inconceivable that women hold just 25% of leadership positions in the health industry. We can't just ignore this shocking disparity. Why is it that women, despite being the majority in the health workforce, are not adequately represented in leadership positions? The glass ceiling is real, and it affects women in every industry, and not just global health. However, in the health sector, and especially in a country like Kenya, the situation is particularly concerning, as women are the backbone of the workforce but are not given the opportunity to lead. Numerous studies reveal the disparity in the number of women who seek leadership positions despite them being highly qualified. There are a myriad of reasons for this, some of which touch on self-worth and or lack of confidence, even when they are highly qualified. Women also face discrimination, both conscious and unconscious bias, lack of access to mentorship and sponsorship opportunities, and work-life balance challenges that disproportionately affects them. The Power of She project focuses on empowering women in the health industry to shatter the glass ceiling and seek leadership positions. I believe that by identifying and supporting the next generation of female leaders at an early stage, we can create a more equitable and diverse industry that better serves the needs of all people. The Power of She aims to better understand the mindset of female health students who are about to leave learning institutions and enter the workforce, so as to better nurture them in seeking leadership positions. The Power of She aims to empower and prepare a cohort of final year students in health training institutions to overcome the barriers and challenges and position themselves to seek leadership positions in the industry through a 6-month coaching and mentoring program. This program seeks to engage these students so that they are intentional and strategic and are able to position themselves so that they are able to reach these positions of leadership. It embodies the 4 pillars of leadership: authentic, inclusive, strategic, and impactful leadership. Authentic leadership is about being true to oneself and having a clear sense of purpose. It involves leading from a place of integrity, being transparent and honest, and staying true to one's values and beliefs. In my project, I aim to encourage and support the cohort members to be authentic leaders and lead from their true selves. Inclusive leadership is about valuing diversity and creating a culture of belonging. It involves recognizing and embracing differences and creating a safe and inclusive environment where everyone can thrive. The project will prioritize diversity and inclusion by ensuring that the cohort members come from diverse backgrounds and by providing them with a supportive and inclusive community. Strategic leadership is about having a clear vision, setting goals and priorities, and taking calculated risks to achieve them. It involves being proactive and forward-thinking and anticipating and adapting to change. In this project, I will encourage the cohort members to be strategic leaders by helping them develop clear goals and strategies with milestones to achieve them. Impactful leadership is about making a positive difference in the lives of others. It involves being mission-driven and focused on creating meaningful change in the world. In this project, I will encourage our cohort members to be impactful leaders by providing them with opportunities to make a positive difference in the health industry. This is by connecting them to women leaders in the industry and networking forums where they can make connections that can make a difference. The Power of She is implemented in collaboration with educational institutions and encourages final years students to participate. While the project involves a small cohort of women, I envision upscaling it in future to reach a wider cohort through smart AI systems for personalized coaching and support, webinars, peer networking, and mentoring support. In conclusion, the Power of She is focused on empowering and supporting women in the health industry to become leaders and create a more diverse and inclusive health industry. With a clear vision, strategic leadership, and impactful results, I am confident that the Power of She will make a positive impact and inspire other women to pursue leadership positions in the health industry. Thank you for your time and attention.